This is Speech 1315, and my name is Eliana Rios, and this is my audience. Are you healthy? See, every time I would think about health, I would think about just physical health, but never mental health. Mental health is one of those things that is sometimes a taboo to talk about, but I'm here today to give a little bit of facts, to give a little bit of information as to what mental health really is. See, to stay on top of your full health, full body health, isn't just to go to the gym, work out, and eat healthy. It's to make sure that you're healthy with your mind, body, soul, and spirit. See, mental health is just like any other type of condition. It's physical. It's an illness. And because it's an illness, I'm here today to tell you a little bit of the causes and the symptoms that you might feel when you might be experiencing mental health. Because it is an illness, you can look out for certain symptoms. Like if you have a lack of sleep, lethargic, if you're always tired. See, pay attention to your sleeping patterns. If you pay attention to your sleeping patterns, you'll see and you'll notice that you just don't have any energy, you're apathetic, you lose interest for a lot of your daily things like going to school, going to work, spending time with your family, with your friends, with your parents, with your children. And this can really begin to affect who you are. You can also have outward symptoms. Maybe your skin might dry out. You might begin to lose your appetite. You might have malnutrition. You maybe might be having poor hygiene. Because it is an illness, there are some causes for it. When there are no causes, that's called endogenous depression. But some of the causes that you might experience or that others might experience is if something happened in your life, a trauma, a tragedy. Maybe it could be neither of those. Maybe it could be that you're experiencing a terminal illness or someone in your family is experiencing a terminal illness like a cancer. That can really affect you emotionally, physically, mentally. If you've experienced or are experiencing domestic violence, or even it can trace back to your childhood, like childhood anxieties, traumas, and stresses. And if it isn't taken care of as a child, it can manifest itself as an adult. See, today society is really affected by mental illness. 15% of today's population, any population that you go, 15% will say that they experience depression or anxiety. Depression is seen mainly in women. 54% of women suffer with depression. Now, the same can't be said for men because only 15% of men actually get diagnosed or reach out and say they need help. Because most men typically don't go and seek for help or even recognize that they have depression or that they have anxiety or that they have a mental disorder. Another crowd that can be affected by mental health is the older generation, the older crowds, the senior citizens, anybody that's 65 and older. Because they have seen sometimes that their life has gone, or they remember their past, or just because of aging. But see, this isn't always have to be the case. You don't always have to suffer with depression, because just like any other illness, it can get treated. So it's okay to seek help. It's okay to seek help because 15% of people that have depression and anxiety go and seek help and are better for it. And if you don't seek help, there could be consequences. Some of them being suicidal thoughts, weight gain, and just completely disassociating and disengaging from your life. So with this, I want to ask you today, knowing everything about depression, knowing the causes, knowing the symptoms, I want to ask you, are you healthy?